So one of the most common topics that we're excited about kind of going forward is people in what we call metastatic breast cancer, which basically means stage 4 breast cancer, where it's left the primary source of the breast and now it's somewhere else in the body, whether that may be liver, bone, what have you. That's a different whole scope of treatment for people with breast cancer, because in that situation, we're trying to put people into remission. That's our goal. And so with that, there has been a lot of advancement in breast cancer. I think the most exciting things are, and now you kind of have to put them into groups. So when we look at breast cancer, we look at, is it hormone driven? And I think that's probably the first part that you stop at and look at. And if it's hormone driven and something we call HER2 negative, which is a specific receptor in breast cancer, that's usually about 2/3 of breast cancers, is hormone driven, specifically breast cancer. And in those people, there has been great advancement about adding what we call a CDK4/6 inhibitor. And there's many different types of these drugs, but it's not chemotherapy. It's actually used with what we call endocrine therapy. And that breakthrough, that drug, has really changed survival in metastatic breast cancer, which is groundbreaking. And I think that's the standard of care now for everybody, if we can use that. But if you take that away and you look at breast cancer in general, we're seeing more targeted treatments. We're seeing people run a lot of what we call molecular tests to look for mutations, to see if we can target these mutations to treat breast cancer. So there are a lot of trials now looking at that, what we call personalized medicine.